Good morning, everybody. It's so nice to have folks join us for an update on the status of our Rural Health Transformation Program. My name is Dan Sinclair. I am the project director for Connecticut's RHTP program, the Rural Health Transformation Program. It's nice to be here. This is our second public webinar, with the last one coming in April 2026. If you didn't get a chance to join us for that webinar back, I think it was on April 13th, both the webinar slides and the commentary, as well as the transcript of the Q&A portion of that event, are available on our website under the Documents tab. I mentioned that point because the first one was really a primer on our entire program writ large, whereas today's webinar is more of a orientation to providing an update on where we stand in our program implementation. And also, it will include a deep dive on one of our initiative areas on population health. So Julie, let's head over to the next slide. Okay. So I won't read this here, as you can clearly see that on your screen, but I'll give folks just a bit of time to read the disclaimer. Let's go over to the next slide, Julie. Thank you. Okay, so today we will aim to have about 15 minutes of slides and then reserve approximately 15 minutes for a Q&A portion for a neat and tidy half-an-hour webinar. With that in mind, you can see today's agenda up there on the screen. Our slides have both a retrospective and prospective component to them, as we'll spend a few minutes supplying an update and giving a sense of what has been our progress to date, and then look forwards to the future to recap where we are headed with grant implementation. As you may remember from our first webinar, we have 4 initiatives that comprise the Connecticut RHTP program. These include number 1, population health, 2, workforce, 3, data and technology, and 4, care transformation and stability. Today, we'll do a deep dive into the population health initiative and do the same with the other initiative areas in subsequent webinars. Next slide. Okay, so since our first webinar, there have been quite a few notable updates that I'd like to share with you guys. Connecticut received its official green light, called our Notice of our Award, or NOAA, from the Centers for Medicare and Medicaid Services, also known as CMS. And that allows us to proceed at full velocity with our Rural Health Transformation Program. Since that time, our entire team across all 11 state agencies have been working as fast as possible to stand up our 30 projects by August of this year. In late May, we concluded our inaugural site visit to the Torrington area in Northwest Connecticut. This was a great opportunity for us as we met with the leadership from Community Health and Wellness, the F2HC in Torrington, to understand the challenges and opportunities that they are seeing in rural healthcare. We held a town hall to provide an overview of the RHTP program for community leaders, and we were really trying to solicit their input on how we can ensure that our program includes as many community voices as possible. After that, we met with the leadership of Greenwood's Counseling and Referrals to understand the challenges that behavioral health providers face writ large in Northwest Connecticut, and more specifically in school-based settings. We concluded our day that day with a visit to Charlotte Hungerford Hospital, where we witnessed firsthand the commitment of hospital leadership to improve rural health throughout the area. I'd also like to mention that we've made a concerted effort to expand our email distribution list and to send out news of key happenings on a weekly basis so that people can be kept informed about salient RHTP program updates, meetings, and the like. If you're not already on that distribution list, we will put up on the screen in a little bit how to do that. It's very simple. Also on the public engagement front, we've updated quite a few state legislators on our program, including as part of an in-depth briefing for the Medical Assistance Program Oversight Council, also known as MAPOC. We've met with other key partners, such as our colleagues at Connie and the Connecticut Health Association. Our PACE director has also recently presented at the Connecticut Association of Adult Services Conference. That was a great opportunity to talk about our plans for PACE as part of the RHTP program. Now, of course, none of this happens without the staff to make this all work. Since our last webinar, we've added 5 new staff, including 2 assistant directors, Tracy Norman and Megan LaDolce, our new PACE director, Carrie Amaro, our new RHTP attorney, David Voice, and our new principal healthcare analyst, Peter Dean. And our partners at our 11 state agencies are doing the very same thing and hiring staff for their respective RHTP teams. Lastly, while we're on this slide, we participated alongside more than 30 other states in the Rural Health Innovation Summit in DC earlier this month. We shared connections with other states and also viewpoints on what we see as the challenges and opportunities for this really important program. Let's go to the next slide. This is about the future. So where are we headed? I'd like to give a sense of what that looks like. We are thrilled to have the very first meeting of the Rural Health Advisory Council to take place on the 25th of this month. This important group will provide the advice and counsel to our program on strategic issues surrounding the grant. We're grateful to the approximately 25 senior members of this volunteer group for contributing their time and expertise in partnering with us on this advisory council. In the next few weeks, we'll also have quite a number of additional public engagements. We'll conduct a site visit to Putnam and Windham in Northeast Connecticut on June 30th, and we look forward to meeting with the leadership of Generations Family Health Center and Day Kimball Hospital. And at the same time, that day, we'll be hosting 2 town hall events in both locations, Putnam and Windham, so that we can hear from as many community voices as possible that day. In July, we'll travel up to the Sharon area so that we can visit with the leadership of Sharon Hospital. August is also shaping up to be an incredibly busy month for us, as we'll be engaged in in-depth reporting to our funders at CMS and are aiming to have all our HTP projects finalized by the end of that month. Let's go on to the next slide. Now, this part is a deep dive into one of our 4 initiatives. And here specifically, we're going to be talking about the projects under the Population Health Initiative. Now, it's important to remember that we have 30 projects all across the 11 state agencies, so we don't have time to talk about all 30 today. So that's why we're breaking this down into initiative areas. We'll cover the Population Health Initiative today, and then the others in subsequent webinars. Under the Population Health Initiative, one can really get a sense of the depth and the breadth of the projects planned under RHTP for the Northeast and Northwest Connecticut focus areas. For example, our colleagues at Aging and Disability Services are working to improve access to exercise programs for older adults to safeguard health and prevent falls. If you enjoy the outdoors, you might have heard about the Airline Trail, and the Connecticut Department of Energy and Environmental Protection will improve health outcomes by really boosting usership of this trail through targeted infrastructure improvements and outreach. We know that the access to trained mental health care providers can be challenging in some rural areas. So our colleagues at the Department of Mental Health and Addiction Services are hard at work in expanding Access Mental Health program to provide psychiatric consultation and training for adult primary healthcare providers. Let's head over to the next slide. Okay, on this slide, you'll get a sense of some more of our projects under the Population Health heading. Our Department of Agriculture is boosting food systems and investment in economic opportunities for sustained health impact. In addition, the RHTP program will fund the deployment of mobile medical and dental vans to bring health services closer to our rural residents. Under the Department of Social Services, we'll improve access and competencies by working with school-based staff, offering psychiatric consultation, guidance, and referrals. Let's go to the next slide. All right, and then here, this is the last slide of my presentation before we open it up to question and answer. So also under the DSS, the Department of Social Services umbrella of the program, we're going to be expanding autism spectrum disorder consultation and support to build competencies in several different medical disciplines. And then lastly, we're all excited about the expansion of the Universal Home Visiting Program. Under the project, the Office of Early Childhood will fund nursing teams and community health workers to visit the homes of postpartum women and their newborns in a bid to improve health outcomes and reduce maternal, newborn, and infant mortality. So we're all very excited about the programs under this heading. And now we're going to be opening it up to questions and answers so that we can hear from you directly. And that will take those via the question and answer tab. So this is different than the chat. So if you do have a question, you can go up to the Q&A feature up at the top of the screen. On my screen, it's immediately to the right of the chat function. Hopefully it'll be the same for you. And you can go ahead and put any questions that you have into that Q&A function. We'll be having Julie from our side manage that as well too. So she'll be reading off the questions and then directing the question to the appropriate staffer. And while you're thinking of any questions, Julie has kindly put up the link to our website so that you can easily sign up for our email distribution list if you haven't already done so. So, Julie, what do we have in terms of any questions so far coming through?
You're on mute, Julie.
Thank you, Gretchen. So we have a question about if an organization isn't based in Connecticut, but they have a footprint nationally, can they partner with a local Connecticut organization? So hold on. A local Connecticut organization, like a provider of live virtual evidence-based exercise classes for older adults. So I would guess I would be taking this question, Dan.
Please.
So yes, if one of our sister agencies reaches out, has a RFP or a notice of funding opportunity, anyone can apply for those if they meet the qualifications of the application. So it's not just closed to Connecticut vendors. So I don't know if there's anything else you wanted to add, Dan, or?
No, I think that's quite good. And thank you for addressing that question.
Mm-hmm.
Do we have any others in the queue?
Let's see. So you mentioned that all it's 30 programs are stood up by August. So does that mean that all RFPs would be released by that time or beforehand? And is that the timing for submission award?
Take that. So as I think we mentioned in the very first webinar, the timelines for this program are particularly ambitious, where CMS has made it clear that states must move with alacrity to stand up their programs. So consistent with state procurement laws and our regulations, we've looked to see if we can use existing mechanisms to be able to allow us to do that. In some cases, there have been procurements published on the street. DMIS had one. OHS currently has one, I believe is still on the street for some health IT related things. But so that is the best thing that I can explain at this moment in terms of how we're proceeding with our work and standing up our program. Anything to add, Julie, from your perspective?
We did have an additional question on where people can find that. And so we have been posting those opportunities on our website. So if you go to, look up the Connecticut Department of Social Services and put in the search bar rural health, click on our page, there are links there for funding opportunities that you can find. Dan, how big is our team now at DSS?
Okay, yeah, I think we're up to 9 staff people at DSS. Of course, that just is the folks working currently on rural health from a technical expert. We also have and continue to rely on our colleagues in procurement and in finance and also in our general counsel's office to assist with different elements of it. So we pull them in as needed.
Okay, and then someone wanted to know what was the amount of our award from CMS?
Sure, that's $154 million for the budget period 1. Now, as I think I mentioned in the very first webinar, that can go up or down between project years, depending on a number of different factors, but most notably kind of progress towards our objectives. So we want to make sure that all that money, all the 154 million stays here in Connecticut and can be put to good use for our rural residents.
Yeah. We do have a few questions about how vendors, folks can get involved and where funding opportunities are. So I think we've answered that the best place to look would be on our website. Also, the Department of Administrative Services has their own website that posts all funding opportunities for the state. So if for some reason one slips by us, which I would find rare, then you can always look at that as well to find funding opportunities. People want to know when are we, what is our launch date for our projects, Dan? September, October? When are we planning to launch them?
As soon as possible, right? So as folks know, the state procurement system takes some time to get the right people brought in and to reviewing our work. So we really anticipate that between now and August that will be the key time period for beginning our work under multiple projects. So it'll look a little bit different for every one of our projects across the 30 different ones.
Mm-hmm. Yep, absolutely. And some are shovel ready, I would say. Some will be in this first year, we'll be doing some planning on how to get them shovel ready. So I don't see any additional questions. I'm just checking to make sure I'm not missing anything. Oh, we have someone that wants more info about the town hall events in Wyndham and Putnam on June 30th. I think I'm going to toss that over to Tracy. Hi, Tracy.
Thank you. Hi.
Can you
Thank
introduce
you.
yourself to everyone?
Yes. So yes, I am Tracy Norman. I was recently hired as an assistant director here. I'm very excited. So yes, on the 30th, we are having two town hall meetings. And the reason why we're having two for northeastern Connecticut is primarily because of the distance between the health center as well as the hospital. So one will be at Day Kimball and the other will be at Generations. And that will be a time to learn more about current statuses of RHTP as well as have a town hall where we're looking to get questions to get answers from the community and from the people who are in attendance. So we'll be asking questions regarding the regional collaborative, which we are also hoping to stand up very soon as well. So any other questions related to that? But that's generally the gist related to the town hall that we're having on the 30th.
If someone wants to participate in the town hall, is there a way that they can get information on it?
Yes, you can actually reach out to me directly. Thank you, Julie, for reminding me of that. You can reach out to me directly, Tracy.Norman@ct.gov, and I will be more than willing to meet with you or give you more information about the town halls.
Thanks, Tracy.
You're welcome.
All right. So our next question has to do with Access Mental Health and our autism spectrum disorder service areas. So I'm going to toss this one over to Megan. I'm finding her in our group here. So Megan.
I don't think it's me actually, Julie.
Pardon me?
I don't think that question is for me. It might be for Tracy as well. I think.
Is it?
Yeah.
Oh, well, Megan, you want to introduce yourself while you're here?
I will. Anyway, sorry about that. Megan LaDolce. I am another assistant director hired right after, just a couple of months ago, less than that. Nice to meet everybody.
And thanks for keeping me honest.
Sure.
Hold on, I'm going back to Tracy. All right, Tracy. So the question is, will the efforts be to increase competencies or to increase the capacity in rural areas?
Capacity. As well as I would actually think of both actually, but more so the capacity is the focus of the Access Mental Health projects that we have going on. And once again, you can also reach out to me if I can give you more information offline in a meeting or something. We can also further discuss then, but it's more so focused on capacity.
Okay, great. Let's see. So one of the questions that we have here someone wanted to know how we're planning to track our performance and outcomes for our initiatives. And were we planning to use existing reporting systems, or are we planning something additional? And if you want, Dan, I can take this one.
Yeah, why don't you go ahead? I might have an additional detail to fill in, but you can certainly
Okay.
start.
Yeah. So as far as the reporting for this goes, we have been working closely with our partners that we've procured for our grant and contract management specialists. So they have been helping us. This is a very unusual grant in that we don't have regular reporting mechanisms. We're going to be evaluated on our ability to implement our programs and spend our funds. So we haven't had the guidance released yet from CMS. So right now we're developing our plans for all of it and how we're going to be tracking based on the information that we do have. So Dan, do you have more to add?
Yeah, and I think, I mean, as we all know, kind of monitoring and evaluating progress can be complex and highly dependent on the individual projects as well. So each agency is also thinking through how they're going to be doing the monitoring and evaluation for their specific programs. And then as DSS, we're also going to be looking at kind of a RHTP-wide methodology for evaluation at a meta level. That's the only thing I would add. Thanks.
Okay. Somebody asked what projects are shovel ready, and the one that comes to the top of my mind is the one with the Office of Early Childhood, their Family Bridge program. They've already been doing that program within the state in the Bridgeport area, and so they're expanding that, bringing that into the Northwest and the Northeast areas, and really, beefing up that program. So that would be one. Can you think of another, Dan, or let me take Margaret, put Margaret on the spot here and see if she can remember any that would be considered shovel ready.
Sure. I think one that was just mentioned, the Access Mental Health programs, those are expansions as well. So so those would fall under that category.
Okay, great. Let's see if we have any additional questions here. There are some questions about, looking on the website. One person said they've only seen, if they want to know if there were going to be NOFOs or RFPs for all the projects. It's just, I think, not for all 30 projects. We don't need, some of these, like that Margaret was mentioning, the Access Mental Health, we would use an existing contractor. But we have had the one so far, and we don't know years 2 through 5 if we're going to need to employ more help. So I would always just keep an eye out to see if we have more opportunities. So.
Any final questions in the queue?
I think I'm going to put. I think I'm going to put Margaret back on the spot here. So I guess the question is the school-based mental health programs only limited to students with significant mental illness, or will it be for everyone who could benefit from behavioral health services?
Sorry, trying to get myself off mute. So, and the expansion of this too is really also looking at the providers and the support and looking at expanding capacity there. So it is open to all students. But yeah, it is looking at expanding kind of that provider support and continued training to increase that capacity.
Great. And again, the best place to check for any funding opportunities would be on our website. So again, if you go to the Connecticut Department of Social Services and put into the search bar rural health, and click on that. It'll take you to our website where you can find links to all kinds of things. What our grant was, what our notice of award looks like, and several other things. There is a question about the mobile integrated health program, wanting to know if there will be a NOFO released for that. Did you want to touch on that, Dan?
Well, we can't comment on the specific procurement that may be planned there, but yeah, if there is more information coming out, then we'll make sure that gets out to the right folks.
All right. And then
Julie,
we just have a few thank yous thanking us. So,
Julie, I do see a question that may have gotten buried down at the beginning that may be important. Someone asks about whether the funds can be used for services focused on people in all classes of towns, or whether they have to be spent for services and for people in rural designated towns only. So are there geographic limits for how the funding can be spent?
Dan?
Yeah, so in the grant application, which the state prepared back in the fall, we put in as our focus areas Northeast and Northwest Connecticut, and more specifically, the rural definitions used by HRSA, the Health Resources and Services Administration. And so that has continued to guide our efforts. And so there's a map that, gosh, I think that's in our program narrative, if I'm not mistaken, on our website that you can take a look at, and that'll kind of answer some questions about our geographic focus.
Yeah, thanks. Thank you for finding that, Carrie. Dan, last question that you mentioned about the 4 stages. When can people expect the data and technology discussion?
Yeah, I'm glad to see there's some interest in that. We haven't yet set a date for that. We will be doing another webinar for sure. We know there's a lot of interest and energy in that. What I will say is maybe we could just foreshadow, Carrie, the webinar that you have planned, so we can get some additional publicity for that. Julie, would you bring Carrie to the foreground so she can just highlight what we have planned on the PACE front?
Sure. Hi, Carrie. Carrie's
Hi.
our PACE director.
Hi, I'm Carrie Amaro. Glad to be with this group. There's a lot of exciting work going on. So on July 7th at 2 o'clock, we will be having an informational webinar about the PACE program, which stands for Program of All-Inclusive Care for the Elderly. So it serves people who have long-term care needs, age 55 and older, and we'll be providing more information about the plans to launch that program in Connecticut. You can get the link and the information about that webinar on July 7th by signing up for the newsletter distribution on the website, and that link was in a slide. So we hope many of you can join us for that and learn more about PACE.
And I think with that, we're going to have to call things to a close. We are at the bottom of the hour there. This has been a really helpful conversation. I'm glad that people have questions. Public engagement is really an important piece for us in the Rural Health Transformation Program. We want to hear from you. We, in fact, need to hear from folks so that we can be successful with our implementation. So this will certainly not be the only opportunity to hear from us and to share viewpoints on this. And as I mentioned, we have quite a docket planned for public engagement activities. So we will see each other very soon. Thanks for attending today's webinar, and all the best.
Thank you, everyone. Bye-bye.